Real. As more cities shut down in the wake of the coronavirus, businesses deemed essential, like pharmacies and supermarkets, are still up and running with workers, many at minimum wage, working really long days at the front lines of this pandemic. The United Food and Commercial Worker International Union, with nearly 1.3 million members across the food industry in the United States and Canada, has been working with major companies like Stop & Shop, Pepsi, Kraft Heinz, Campbell Soup, Safeway, and Rite Aid to implement new policy aimed at keeping those workers safe. Joining me now, Mark Perrone. He's president of the United Food and Commercial Worker International Union. Mark, we are seeing more cases of workers who are getting sick. Do we need more protection for them?
Yes, Stephanie, we really do. I can't stress that enough, and I think it is in fact difficult in order to do that because the personal protection equipment is just not available unless you're a first responder. And as seen earlier this morning on Morning Joe, there will be transmission points for this virus if we're going to stop it. We believe some of those transmission points will be grocery stores, pharmacies, and some of those essential businesses that will have to remain open.
We know some of the bigger chains can afford to do it, but should these people be getting increased wages given what they're putting themselves through?
Well, we ultimately believe that they should be getting increased wages because of the amount of increase of sales per man hour that's taking place. So the shareholders and the corporations are doing really well through that process. And those workers are actually delivering that increased productivity. And that's why that we ultimately believe that they should get it. It's just having the opportunity to share in some of that. We also think that because that is taking place, the owners and the shareholders have a responsibility when it's available to provide that personal protection equipment, or at least when it's not available to provide screens, plexiglass screens up on each check stand so that it gives them more protection that they presently have right now. We think that's important and we think it's critical. And some of our employers have started to do that systematically through their stores.
Whole Foods and its owner, Amazon, have faced major backlash on their policies towards workers. Whole Foods even saying that those who could not work peak hours could lose their full-time status and health benefits. Have they changed any of their policies in a meaningful way in the last week or so?
Well, Whole Foods is a non-union corporation owned by Amazon, and I do believe it is Amazon's position as well as Whole Foods' position to maximize their profits right now, even at the expense of those workers. I think it's a terrible thing to do. I think it's irresponsible. I think it's irresponsible as it relates to what they're doing for their customers, because if people believe, for instance, they can't go to work, because if they don't go to work, they're going to lose their health care. Here's what's going to happen. They're going to show up at work, whether or not they're sick or whether or not they're not sick. And if that takes place, it's just like I said earlier, there's going to be a transmission point that's going to take place in some of these stores. That's the reason why we're fighting so hard to make sure that workers who are impacted by the virus, in other words, they have symptoms, that they can ultimately themselves take themselves out of the public and protect the customers that they're wanting to serve, as well as their coworkers that are serving us, to make sure that we have food on the shelves and that we've got everything available to us. It's the same way with the packing and food processing sections that we are connected with. Those workers are working in close proximity of others. And it's necessary for them to be able to take themselves out of the assembly line positions so that they ultimately can protect each other, because many of those places are located in the rural parts of the United States where healthcare systems are already stretched to the limit, as well as there's not as many workers in those outlying areas that they could draw upon to replace very quickly.
Thank you.